As Smith County prepares to potentially join a lawsuit against several pharmaceutical giants in reference to the continued opioid crisis, East Texas medical professionals are speaking out about the crisis itself.
According to the lawsuit first filed by Upshur County officials, accidental drug overdose is the leading cause of death for Americans under the age of 50. 2/3 of those deaths are opioid overdoses. For more, here is KLTV 7's Doug Murray.
According to the CDC, the number of overdose deaths involving opioids has quadrupled since 1999. And local doctors agree, saying the trend in their use started in the late 90s. Then as opioids became a more common way to treat chronic recurring pain, addiction also became common.
And in 2000, it was mostly big cities on the east and west coast. And then 2005, and then 2010, and by 2015, it was just the whole map was now red and yellow instead of, blue, and it's clearly everywhere.
Dr. Clint Carter with Neighbors ER says the most common victims of opioid addiction are white males in rural areas.
The opioid receptors in your body ultimately get used to having it all the time, and so that becomes your new normal.
They work to help control acute pain, but they're not a good thing to use for chronic pain, and most of the pain management doctors have realized that and are trying to use other methods.
Dr. Gary Williamson has worked with CHRISTUS Trinity Mother Francis since the early 90s.
And I can definitely say that there's been an increase in people who come in with apparent problems with opioids.
Both of these doctors add that there are people who sometimes need more than a strong anti-inflammatory medication. The tough decision, though, is deciding if they need full-strength opioids for treatment. Doug Murray, KLTV 7 News.
Those doctors also said there's been a trend to curb and even avoid giving opioid prescriptions. They say they're always on the lookout for patients who lie about pain to try to dupe them into prescribing those drugs.
Ahead